My name is Andrew Gaeddert, and I'm the director of the Get Well Foundation. And it's a nonprofit organization, and it specializes on educating people about herbs and nutrition. And I've been an herbalist for over 35 years. I ran an advisory service for health professionals in Oakland, California. And I also ran a clinic where patients suffering from chronic fatigue, cancer, digestive disorders, brain fog, poor sleep, and other conditions could get help. Well, in the first place, when I was a young man, about 18, 19, I started having symptoms, digestive symptoms. And I went through a battery of regular Western medicine tests, and they were inconclusive. They said that I had spastic colitis or nervous indigestion. And those were the terms that back then that they used for what we now call irritable bowel syndrome or IBS. And basically, it culminated in showing up in the hospital in Santa Cruz, California, with basically, I was almost close to death. I was very weak, and I'd been sick for a number of days with I thought was food poisoning. But at the end of the 10 days, they basically told me we suspect that you have Crohn's disease. And now the medications I was on, for the most part, made me sick. So I stopped taking the Western drugs and I figured I'm going to have to figure this out myself. Now, in the early days, I started having symptoms. One of my relatives said, well, you should drink, if you have digestive problems, you should drink mint tea, either peppermint or spearmint. And I actually noticed that that helped, but that wasn't enough to cure Crohn's disease. So basically, I searched out every opportunity I could possibly find, and I found that what helped the most for my Crohn's disease was actually Chinese herbal medicine. I also was an acupuncture patient. And it wasn't miraculous, it wasn't instantaneously, but overall, my health got better and better and better. I used to have flare-ups that lasted 3 weeks, and after a couple months of taking herbs, the flare-ups lasted 3 days. And then after a couple of years, the flare-ups, Crohn's disease flare-ups lasted a couple of hours. And so I found that the herbs were very effective at keeping me healthy and also helping me deal with the symptoms and then helping me recover from the flare-ups. So I firsthand felt a lot of benefits of herbal medicine, and I really wanted to make them more available to the general public. And that led me to starting a company and also starting a practice. Well, I have a certification. I'm a certified herbalist, and I've done classroom study. But what I'm most proud of is my internships. And so I had two mentors. One had over 60 years experience, and the others had over 50 years experience with Chinese herbal medicine and acupuncture. And so basically, how these mentorships work is, well, for about 10 years, I practiced side by side with this master herbalist. And he helped me understand Chinese medicine from somebody who had practiced in Asia for, again, 50 or 60 years in the hospitals and clinics in both Hong Kong, China, and Vietnam. So I think that it really helped me work with practitioners or mentor with practitioners who were used to seeing people with serious health conditions. And in Asia, especially in the past, people's health was the only way to help people's health was through herbs and acupuncture. They didn't have Western medicine. Well, we have a nonprofit foundation, and our goal is really to get information out there. And I realized that much of the information on YouTube, it has a conflict of interest. In other words, what's the New York Times? The New York Times sells news, but what they're really interested in promoting is the New York Times. The Mayo Clinic is a medical institution, and they provide health information, but they're mainly interested in promoting the Mayo Clinic. So, and then there's numerous experts out there in the YouTube world and the blogosphere who, know a lot, but behind what their education is what they're selling, a product or service. And so I wanted to be in a position where I was just giving information about herbs and nutrition. I wasn't selling a product, I wasn't selling a service. And I wasn't endorsing a specific brand. So we don't discuss brands, we just discuss substances like vitamin A or echinacea, not brand X of echinacea or brand Y of a nutritional supplement. Now, the chief benefit of herbs is that they are safer than drugs. And many people don't really understand this, particularly if we're reading the major media. But there's well over 100,000 deaths every year in the United States due to prescription drugs. Every year, maybe there's one death in the United States due to herbs, and it's typically somebody who's psychotic or schizophrenic, and they don't eat any food, and they just overdose on herbs. So the herbs are much safer not only than drugs, but they're actually even safer than conventional foods. So in the United States, again, thousands of people die each year due to food poisoning. And typically they get this at fast food restaurants. So the point is that herbs are very safe. Now, the problem with drugs, there's real two problems with drugs. One is that they're overhyped. So when we go to a doctor, oftentimes what's going on is we're being sold drugs. We're being sold drugs or surgery, right? They do not like herbs and nutrition because there's no way that this can they don't see any way it could benefit them. You know, they might recommend an herb and it might harm a patient and then they get sued. Another thing that we're offering that's unique about this is we're offering the clinical use of herbs, right? Everybody says, you know, there's a lot of information out there on the blogosphere and publications. Oh, take peppermint for digestive problems, right? But as an herbalist, I need to know, what's the dosage? How do I get the peppermint? How do I take the peppermint? What's the best source of peppermint? And do I take an essential oil? Do I take a tea? Do I take a tablet? Do I take a pill? Do I take a tincture? These are all questions that herbalists need to know about when they, treat patients. So I think, again, herbs are a tremendous opportunity for people who are looking to limit side effects in their life. So you have a symptom, you try herbs. The herbs don't work, try another herb. The other herb doesn't work, go see your doctor, right? And it works in reverse, unfortunately, in America. We have a symptom, we go to a doctor. If that doesn't work, we go to another doctor. That doesn't work, go to another doctor. And then we're at wit's end and we might see an alternative practitioner or try an herb. But it's really upside down. We should be looking at the herb and nutrition first and then the drug later. And if the herb and nutrition doesn't work, then we use Western medicine. The documentary is called Hope for Chronic Fatigue and Long COVID. And it comes about my experience with helping practitioners and patients with COVID and long COVID during the pandemic. And the reason specifically I wanted to make the movie is that there's not a lot of information on long COVID out there. Many doctors don't know about long COVID. In 2020, in California, outside of San Francisco, one of my colleagues had long COVID. He went to the doctor and the doctor said, "What's long COVID?" So a lot of doctors don't have any idea what it is or how to treat it. And then finally, if somebody wants to adopt the conventional model for long COVID, it's basically enrolling in a university clinic. So there's about 20 centers, as far as I know, across the country, typically affiliated with universities, and they have long COVID clinics. Now, the problem with that is one of my former patients contacted the local long COVID clinic, and she was told that there would be a 6-month waiting list to see her. And she figured, well, I need help now, not in 6 months. And so she called her herbalist and acupuncturist and got some help right away. So I wanted to really tell people that whether you believe in alternative medicine or not, if you're not getting help with long COVID or chronic fatigue in the Western clinic, why don't you consider visiting an herbalist, a naturopath, or an integrative physician that can help you recover your condition. If you'd like to know more about us, please visit our website at getwellfoundation.org.